Lyme disease is a tick-borne illness caused by the bacterium Borrelia burgdorferi. It is transmitted to humans through the bite of infected black-legged ticks, also known as deer ticks. The disease is named after the town of Lyme, Connecticut, where a cluster of cases was first identified in 1975. Symptoms of Lyme disease can vary widely and may include a rash, fever, headache, fatigue, and muscle and joint aches. If left untreated, the infection can spread to the joints, heart, and nervous system, causing more severe symptoms such as arthritis, facial paralysis, and meningitis. Diagnosis of Lyme disease can be challenging, as symptoms may be similar to other illnesses and not all patients develop the characteristic bull's eye rash. Blood tests can be used to detect antibodies to the bacteria, but they may not be reliable in the early stages of the disease. Treatment for Lyme disease typically involves a course of antibiotics, which are most effective when started early in the course of the infection. In some cases, patients may require longer courses of antibiotics or additional treatment for persistent symptoms. Prevention of Lyme disease involves avoiding tick bites, particularly in areas where the disease is endemic. This can be done by wearing protective clothing, using insect repellent, and checking for ticks after spending time outdoors. Vaccines for Lyme disease are currently not available for humans. Overall, Lyme disease is a significant public health concern, particularly in areas where the disease is endemic. Early recognition and treatment of the infection can help prevent more severe symptoms and complications. Lyme disease is a tick-borne illness caused by the bacterium Borrelia burgdorferi. This bacterium is primarily transmitted to humans through the bite of infected black-legged ticks, also known as deer ticks. These ticks are commonly found in wooded and grassy areas, particularly in the northeastern and midwestern regions of the United States. The transmission of Lyme disease occurs when an infected tick attaches to a human host and feeds on their blood. The bacterium can then enter the bloodstream and spread throughout the body, causing a range of symptoms. However, not all ticks carry the bacterium, and not all tick bites result in Lyme disease. The risk of contracting Lyme disease is highest during the spring and summer months when ticks are most active. It is also more common in individuals who spend time in wooded or grassy areas, such as hikers, campers, and hunters. Additionally, individuals who live in areas with high tick populations are at an increased risk of contracting the disease. Symptoms of Lyme disease can vary from person to person and can include fever, fatigue, headache, muscle aches, and a characteristic bull's eye rash at the site of the tick bite. If left untreated, Lyme disease can lead to more severe symptoms, including joint pain, heart palpitations, and neurological problems. Diagnosis of Lyme disease is typically based on a combination of symptoms, medical history, and laboratory tests. Treatment typically involves a course of antibiotics, which can effectively kill the bacterium and prevent further complications. Prevention of Lyme disease involves taking precautions to avoid tick bites, such as wearing protective clothing, using insect repellent, and checking for ticks after spending time outdoors. It is also important to remove any ticks as soon as possible to reduce the risk of transmission. In conclusion, Lyme disease is a serious illness caused by the bacterium Borrelia burgdorferi, which is primarily transmitted through the bite of infected black-legged ticks. Prevention and early treatment are key to reducing the risk of complications and ensuring a full recovery. 1. Wild-caught salmon. Rich in omega-3 fatty acids, wild-caught salmon can help reduce inflammation in the body, which is beneficial for those with Lyme disease. 2. Dark leafy greens. Packed with vitamins and minerals, dark leafy greens like spinach and kale can help boost the immune system and support overall health. 3. Garlic. Known for its antimicrobial properties, garlic can help fight off infections and support the immune system. 4. Turmeric. This spice contains curcumin, which has anti-inflammatory properties and can help reduce pain and inflammation associated with Lyme disease. 5. Berries. Rich in antioxidants, berries like blueberries and strawberries can help protect the body from damage caused by free radicals and support overall health. 1. Sugar. Consuming sugar can weaken the immune system, making it more difficult for the body to fight off Lyme disease. Additionally, sugar can increase inflammation in the body, exacerbating symptoms of the disease. 2. Processed foods. Processed foods often contain high levels of preservatives, additives, and artificial ingredients that can be harmful to the body. These foods can also be high in sugar and unhealthy fats, which can worsen inflammation and weaken the immune system. 3. Gluten. Gluten is a protein found in wheat, barley, and rye that can trigger an immune response in some people. This can lead to inflammation in the body, exacerbating symptoms of Lyme disease. 4. Dairy. Dairy products can be difficult for the body to digest, leading to inflammation and a weakened immune system. Additionally, some people may be sensitive to the proteins found in dairy, which can exacerbate symptoms of Lyme disease. 5. Alcohol. Alcohol can weaken the immune system, making it more difficult for the body to fight off Lyme disease. Additionally, alcohol can increase inflammation in the body and exacerbate symptoms of the disease. Lyme disease is a bacterial infection that is transmitted to humans through the bite of infected black-legged ticks. The disease can cause a range of symptoms, including fever, headache, fatigue, and a characteristic rash. If left untreated, Lyme disease can lead to more serious complications, such as joint pain and neurological problems. Here are some ways to prevent getting Lyme disease. 1. Avoid tick-infested areas. Ticks are commonly found in wooded and grassy areas, so it is important to avoid these areas if possible. If you do need to go into these areas, try to stay in the center of the path and avoid brushing up against vegetation. 2. Wear protective clothing. When going into tick-infested areas, wear long-sleeved shirts and pants, and tuck your pants into your socks. This will help to prevent ticks from getting onto your skin. 3. Use insect repellent. Use an insect repellent that contains DEET or another EPA-approved ingredient. Apply the repellent to your skin and clothing, and reapply as necessary. 4. Check for ticks. After spending time in tick-infested areas, check your body for ticks. Pay special attention to areas such as the scalp, the hind ears, and in the armpits and groin. 5. Remove ticks promptly. If you find a tick on your body, remove it promptly using tweezers. Grasp the tick as close to the skin as possible and pull it straight out. Do not twist or jerk the tick, as this can cause the mouthparts to break off and remain in the skin. 6. Treat pets for ticks. Pets can bring ticks into the home, so it is important to treat them with a tick repellent or tick collar. Check your pets for ticks regularly, and remove any ticks promptly. By following these steps, you can reduce your risk of getting Lyme disease. If you do develop symptoms of Lyme disease, such as a rash or fever, see a healthcare provider as soon as possible. Early treatment with antibiotics can help to prevent more serious complications. Lyme disease is a bacterial infection that is transmitted to humans through the bite of an infected tick. The disease can cause a range of symptoms, including fever, headache, fatigue, and a characteristic skin rash. If left untreated, Lyme disease can lead to more serious complications, such as joint pain and neurological problems. Fortunately, there are several ways to treat Lyme disease. The most common treatment is a course of antibiotics, which are typically prescribed for 2 to 4 weeks. Antibiotics can help to kill the bacteria that cause Lyme disease and reduce the severity of symptoms. In addition to antibiotics, there are several other treatments that may be used to manage Lyme disease. These include 1. Pain relievers. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help to reduce fever and relieve joint pain. 2. Anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin or naproxen, can help to reduce inflammation and relieve pain. 3. Corticosteroids. In some cases, corticosteroids may be prescribed to reduce inflammation and swelling. 4. Intravenous antibiotics. For more severe cases of Lyme disease, intravenous antibiotics may be necessary. This involves administering antibiotics directly into a vein, typically in a hospital setting. 5. Herbal remedies. Some people may choose to use herbal remedies, such as garlic or echinacea, to manage their symptoms. However, there is limited scientific evidence to support the effectiveness of these remedies. It is important to note that early treatment of Lyme disease is key to preventing more serious complications. If you suspect that you may have been bitten by a tick and are experiencing symptoms of Lyme disease, it is important to seek medical attention right away. Your doctor can help to determine the best course of treatment for your individual case. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.